No, not with WIC.
Oh.
Let's see if there's anything from finance here, anything from the LAO. Any public comment on this budget change proposal? Thank you for the presentation. We'll move on to issue 5. I'm sorry, members of the committee, did you have any questions? Thank you. We'll move on to issue 5. California Personal Responsibility Education Program Budget Change Proposal. Ms. Mitchell, when you are ready.
I'll be addressing that because right now I'm also serving as the division chief for maternal, child, and adolescent health. And so this BCP is for our PREP program, which is the Personal Responsibility Education Program of California. It's administered through the Maternal, Child, and Adolescent Health Program. We're asking for $6.4 million in state an authorization, $700,000 of that in state operations and $5.7 million for local assistance. This is a program that has been in place since 2010, so this is a continuation funding, and we're requesting to move some of our, we have 5 limited term positions that we would like to move to permanent positions.
Thank you.
There was questions that were raised. We just got the questions on Friday, so we are preparing a written response on them for you about the costs of the program exactly. But just in general, I think it's important for you to know that this program has, I think, excuse me, let me go back. I think I lost my.
Are you referring to the Adolescent Family Life Program?
Ahead, I'm sorry.
Well, we'll catch up. But
no. Okay, sorry.
We like that you're a step ahead.
I'm trying to be expeditious.
It's okay. It's all good. Thank you. Anything from finance on the PrEP program budget change proposal from the LAO's office? Committee questions? Any public comment on the PrEP proposal? Seeing none, we'll move on to issue number 6.
Okay.
Stakeholder proposal, Adolescent Family Life Program. Nancy Ballard is also going to join us. Please feel free to join us at the witness stand. Ms. Mitchell, when you are ready. Ms. Ballard, do you want to frame the proposal, and then we'll have...
Yes, I was just going to present the proposal to have the $6 million restored to AFLP in the 16-17 fiscal year based upon current teen birth data. Let me preface that by saying that I'm Nancy Ballard, the Ventura County Public Health Adolescent Family Life Program AFLP Director and Regional Representative Co-Chair. Established in 1985, AFLP is a comprehensive case management program that works with expectant and parenting teenagers, high-risk expectant parenting teenagers and their children to improve the health, educational, social, and economic challenges of adolescent pregnancy and early parenting. The program is housed within the California Department of Public Health's Maternal, Child, Adolescent Health Division. I have worked for AFLP for over 20 years and have firsthand knowledge of the quality, benefits, and success this program offers. During the 09-10 fiscal year recession, all $10.7 million in state general funds for AFLP were eliminated, which resulted in the loss of $5.4 million in matching federal Title XIX funds. This funding loss was devastating, and thousands of teen clients lost services. Over the past 6 years, federal Title V funding reductions have resulted in an overall funding loss of $18 million. Although the teen birth rate in California is declining, there remain significant ethnic and racial disparities in adolescent childbearing. There's a strong need for AFLP services for the low-income population. AFLP addresses client cultural diversity and is serving the teen birth demographic. Many youth live in poverty, dysfunctional, and unstable home environments, have emotional and mental health problems, have dropped out of school, poor self-esteem, and lack adequate resources. Goals of AFLP are to improve healthy birth outcomes and parent-child health, reduce repeat pregnancies, prevent school dropout, and provide resources for needed support. AFLP provides one-to-one case management services to assess clients to make sure basic needs are being met, such as food, clothing, and shelter, and provide education on a multitude of topics. AFLP is a strength-based program that assists teens to develop goals and build the resilience and skills that will help them succeed and lead healthy lifestyles. 86% of AFLP clients are in school, graduated from high school or the equivalent, which is very impressive when compared to the national dropout rate of 60% among parenting teens who fail to finish high school. In addition, repeat births of AFLP clients is only 2.6% compared to 17% of California teens overall. Teen births and poor birth outcomes result in a high cost to the state and to society. A restoration of $6 million in general funds for AFLP will help the state to leverage additional matching federal funding to serve more families. AFLP does change the trajectory of this vulnerable teen client population and directly impacts the successful outcomes of the teen parent, the child's life, and on into future generations. On behalf of the teen parents and the children that are currently without services in California, we hope that California will return its focus on prevention and improved health and socioeconomic outcomes that AFLP offers. This program serves 2 generations in one, thus doubling the state's investment. Thank you for this opportunity to testify. I also want to say one quick thing. I have 2 or AFLP alumni who've flown up here from LA County just in order to be able to talk to you and testify, and I really think that their testimony can illustrate the benefits of AFLP.
Why don't you bring them up?
Yes, that'd be wonderful.
We'd love to hear from them. While they're coming,
We have Zamara Pena and Susanna Cervera.
please come on up, and we'd love to hear your testimony. While they're coming, is there anything from finance, anything from the LAO's office?
Thank you.
Welcome.
Thank you.
Tell us, just introduce yourself and tell us a little bit about what you'd like us to know about the program.
Well, I wrote my statement down, so if you don't mind, I'll be reading off of it. Members of the committee, thank you for giving us the opportunity to talk about the importance of restoring the funds to the Adolescent Family Life Program. My name is Susana Cervera, and I'm here to share my personal story of why this program is vital to our communities. I grew up in a very impoverished home and lacked the support I needed to embrace the world as a 16-year-old teenage parent. My mother, a single mother of 4, was a teen parent herself and had conceived me at the age of 18. The support and guidance of my mother was absent, since she worked endless hours to barely make ends meet. There were many reasons for me not to succeed. Fortunately, I was introduced to Aledo Family Centers by one of their case managers who visited me at my school. We instantly built rapport as she took time to listen and help me address my immediate needs. My case manager connected me to job preparation classes, parenting classes, and support groups. Through AFLP, I was introduced to a world of possibilities when the odds were against me. I gained the tools and resources that were vital for me to overcome my challenges. I was able to graduate from high school, build social connections, pursue a higher education, and of course, build a healthy relationship with my daughter. My daughter is now a teenager and has never been deprived of my nurturing or care. I have been able to create a safe environment where my daughter's needs and concerns are always addressed. A place where my daughter understands the importance of communication and her well-being. My daughter has more than I ever had and a great opportunity to succeed in life. Through the support and guidance of AFLP, I was given the tools and resources necessary not only to succeed as a citizen, but as a parent as well. Programs like AFLP have impacted my life and my future generation. And because of that, I can say that my daughter will be the first to break the cycle of teen pregnancy in my family. I've always appreciated the supportive services that I received through the AFLP program, so much so that I'm currently case manager for Aledo Family Centers, focused on providing services to teen parents in the AFLP program. I am proud to say I have the pleasure of providing supportive services to teen parents, a community I was once a part of. In a way, I reached a full circle. In addition to being a case manager, I'm also one of the founding members for the Aledo Family Centers Alumni Association. Our group has advocated for the reinstatement of funds in the past as we firsthand understand the value that these programs provide. We volunteer our time to put together educational workshops on higher education, how to write a scholarship, how to apply for FAFSA, workforce training, and much more. We have even funded scholarships for teenage parents seeking their college education. We have proven to be positive influences in our communities. Restoring funds can also help hire more staff to ensure quality case management relationships and provide the staff with training funds to increase new skills and apply them with the teen parent population. And just to name a few comprehensive trainings such as lactation education, sexual and reproductive health, infant massage are all valuable tools to help educate the teen parents and potentially increase breastfeeding rates, aid a healthy bond between the mother and the child, and reduce repeated pregnancies and births. Please don't see teen pregnancy as a problem, but rather as a challenge for the teen parents who need programs like AFLP that will impact our future generation. Please reinstate the funds to these meaningful programs for the teen parents across California. Thank you.
Thank you for your testimony, and congratulations to you and your daughter, and thank you for working in the program and for advocating for other youth in California. Thank you very much. We welcome your testimony.
Members of the committee, thank you for, first off, providing this platform for us to speak today about these very important issues and the reinstatement of these funds. My name is Xiomara Peña. I am the chair of the El Nido Family Centers Alumni Association. As previously discussed, our alumni is composed of previous teen parents who have received case management services through a variety of programs, including CalLearn, AFLP, GRID, and several others. As you know, the overall reduction of over $18 million in the program funding has resulted in nearly a 22% decrease in the number of teen parents receiving the supportive services throughout the state of California. And for the next couple of minutes, I do ask that you keep an open mind when it comes to hearing about the personal following story, which is my personal following story. As a single teen parent by the age of 17, and growing up in a low-income community with limited resources, I knew I was faced with several challenges and obstacles. My parents, both immigrants, worked endlessly to barely make ends meet. And although they were supportive, they were not equipped to handle the level of support I would need if I were to continue with my educational journey. Within a week of learning about the AFLP program through El Nido Family Centers, I had a case manager. She helped me address my immediate challenges like obtaining Medi-Cal and prenatal services. And over the next years while I was in the program, she was vital to helping me understand positive parenting skills, information about immunizations for my child, financial aid, college applications, and much more. Without her guidance and support, without her very intensive case management services, I don't believe I would be where I am in life today. I was the first in my family to graduate high school and subsequently attend a four-year university. By the age of 21, I graduated with my Bachelor's of Science in Business Management. I was able to attend school by qualifying for FAFSA and receiving 9 scholarships, many of which were resources provided by my case manager. While a student, I interned for local elected officials in the San Fernando Valley, which provided the foundation for a love and admiration of public policy. Currently, I'm the Southern California Outreach Manager and the National Hispanic Outreach Manager for a national nonprofit organization focused on small business public policy issues. Our work really revolves around advocating for public policy solutions that address small business owners on topics that include retirement security, the Borrower's Bill of Rights, clean energy, workforce benefits, and much more. While I was thankful for having these services available at a time in my life when I was extremely vulnerable, I am even more thankful that these programs like AFLP existed to help me ultimately gain the tools and resources necessary to become a self-sustaining and self-sufficient adult. These programs have the potential to positively impact our local economies by preparing vulnerable communities with the tools to move up the socioeconomic ladder. The fiscal impacts of these programs are quite clear. When you spend a little to help someone in need, to find the resources that can help them become economically viable, they won't be needing future handouts or welfare or other state supportive services because they will be equipped to pay for it themselves. According to the Public Health Institute, the California teen births bring about an annual cost of about $870 million to taxpayers and an annual total net cost to society of about $3.6 billion. The reality is that by and large, teen parents tend to come from low-income communities, underserved populations, and communities of color. By expanding these programs, teen parents can receive the tools and resources they need to become productive, tax-paying adults and limit the need for state-funded supportive services in the future. It has the possibility of ending generational cycles of poverty. In addition to the positive fiscal impacts this restoration spring. I'd also add that teen parents have access to programs like AFLP tend to have lower repeat birth rates than teens who aren't in AFLP program, which is approximately 2.6% versus 17%. I'm proud to say that my children will have even greater opportunities to succeed in life than I did, and in large part that is because of programs like AFLP. They won't ever see me struggle the way that I had to see my parents financially struggle. In closing, I'm not here to simply talk about myself and my story of perseverance, but I'm here more so to talk about the opportunity for other teens to have the same chance and to succeed and simply not become another statistic. Please restore the funds to these vital programs for the teen parents of California. Thank you.
Thank you for your testimony, for your leadership, and for your advocacy for the program. Thank you, Ms. Ballard, for bringing two great witnesses, wherever you are. There you are. Thank you for bringing two great spokespersons and advocates to talk today. You know, our agenda isn't set up that we'll take action on this today, but when you go back to your peers in your community, you can let them know that the committee heard you loud and clear on the importance of this program, and we really appreciate you for your testimony. Thank you.
I wanted to add that there were 3 questions that came forward, and we will prepare a written response. But just to give you a rough idea, that in 2008, 2009, we had about $11 million in state general funds and Title V funding. So we were able to serve about 18,000 youth in that year. Last year, we had only Title V funding, and that has been reducing over the years to $4.7 million. We were only able to serve a little less than 4,000 youth last year, so it's been a huge impact.
Thank you. Is there any public comment on this item? Come forward, public comment.
Nicole Wertelman on behalf of the Ventura County Board of Supervisors in support of the $6 million restoration. In 2009-10, when the funding was cut, we had to eliminate services to about half the county and essentially take away a lot of the services and the other half that still had some services. As you can see, it's an extremely effective program, and we need to put some more funding into it.
Thank you.
Good afternoon, Matthew Marson with Public Health Institute. Our research was referenced in the testimony provided today. We're the home of the Center for Research on Adolescent Health and Development, and we're in support of this proposal today. So thank you.
Thank you.
Justin Garrett with the March of Dimes. One of the other critical reasons for this program is that babies born to teenage mothers are more likely to be born premature and have lifelong medical conditions associated with that. And this program really meets a critical need for these mothers in the time in their life. And so we're supportive of restoring the state general funds. Thanks.
Thank you.
Karen Farley with the California WIC Association, and just wanting to describe the collective success of our communities, our families, and our programs means that we have a rich menu of services to offer our families, and one program can't serve all the needs. So WIC really relies on programs like AFLP for certain supports that our families need, and AFLP relies on WIC. So having these services out there is really important for our collective success.
Thank you.
Hello, good afternoon. My name is Maria Bass with Ultimate Health Services. In 2015, we served about almost 1,000 teen parents through the AFLP program. And we've seen the cuts and the losses throughout the years. So we're in full support for the restoration of the $6 million.
Thank you.
Good afternoon. My name is Marilyn Gallagher with Clinica Sierra Vista in Kern County, California. Back in 2009, when we lost the state general funds, I had to lay off 42 employees, and I only have 2 case managers left in this program. So it is vital. I totally support the restoration of the state general funds. Thank you.
Thank you. Any additional public comment? Seeing none, thank you to all of our speakers. We'll move on to issue number 7. Thank you, Ms. Nelson. Issue number 7, active transportation budget change proposal. We welcome Mark Starr from the Center for Chronic Disease Prevention and Health Promotion, Greg Oliva from the same agency, and from the Department of Public Health. Whenever you're ready.
We're ready.
Please begin.
Good afternoon, Mr. Chair.
Afternoon.
As you mentioned, I'm Mark Starr. I'm Acting Deputy Director for the Center for Chronic Disease Prevention and Health Promotion, and I have with me Mr. Greg Oliva, who's the Assistant Deputy. The mission of our center is to prevent and control chronic diseases, as you might guess from the name. We address many specific diseases, things such as cardiovascular disease, cancer, diabetes, but we also endeavor to prevent and control diseases related to behavioral, environmental, and occupational factors. To that end, we have 3 budget proposals we'll present to you in a moment this year that promote and support safe and healthy environments and communities to try and have healthy places for people to have the opportunity to be healthy. Mr. Oliva will first provide an overview of each budget proposal, and we'll address the specific questions that you have about each. We'll also provide an overview and update of violent death reporting systems. And then later on, Dr. Jay Kumar, our State Dental Director, will join us to provide an overview of the Office of Oral Health and respond to some of the questions about that. So we'll be up here for a while, and we'll look forward to spending time with you. And we also look forward to learning more about the various stakeholder proposals that are relevant to our programs and providing technical assistance where that's helpful. So thank you for the very nice write-ups in the agenda. It makes our job a little bit easier. And I'll turn over to Greg Oliva to present the budget change proposals.
Good afternoon, Mr. Chair. Greg Oliva, Assistant Deputy Director, Center for Chronic Disease Prevention and Health Promotion. And good afternoon to members and staff. Our first proposal is the Active Transportation Safety Program. We're requesting 4.5 positions and $733,000 in expenditure authority. This program, the Active Transportation Program, was created in Caltrans in 2013, and it consolidated a variety of programs, including the Transportation Alternatives Program, the Bicycle Transportation Account, and what is primarily interesting we're focused on in the Department of Public Health is the Safe Routes to School program. So we've entered into an interagency agreement with Caltrans to provide technical assistance and training to all potential applicants for Safe Routes to Schools funding, the non-infrastructure related piece of Caltrans' portfolio. And the proposal also has a current year implementation. Historically, the contract to provide the technical assistance and training has been between Caltrans and the University of California at San Francisco. Caltrans sought out to work with us, and we were very interested in doing that because we have a very strong interest in the Safe Routes to School program. And UC San Francisco was no longer interested in continuing with that arrangement, so we entered into the agreement and have the current year implementation, and I'm proud to say that we've filled all the positions and we've maintained a large part of the continuity that existed within that program because some of the staff that worked for UCSF applied for state exams and we hired them to keep doing the work. Examples of some of the things that we do are providing toolkits for locals for them to be able to look at what kind of assets they have in their community to create safe routes to schools, sidewalk infrastructure, safe paths, things like that. And we do webinars to really get interest from the locals to apply for the funds. Some webinars that we've recently conducted have been for rural communities and then also American Indian communities. So happy to answer any questions.
Thank you. Anything from Finance? Anything from the LEO's office? Is there any public comment?
Matthew Master with Public Health Institute, just again in strong support of this proposal, and both for our work in climate change but also sustainable communities, the importance of active transportation and safe routes to school. In fact, we have a lot of hopes that we can expand this work to look at safe routes to food, as well as people are trying to get access to healthy food in their communities and also be active in transportation, cycling, walking, etc. So thank you very much.
Thank you.
William Haar with Prevention Institute, also in support of this.
Thank you. Any other public comment? We are leaving this item open, but seeing no other public comment, we'll move on to issue number 9, the biomonitoring program, limited term funding budget change proposal, and stakeholder augmentation proposal. We'll hear again from Mark Starr and Greg Oliva. We'll hear from Nancy. My apologies, I'm getting ahead. We're going to start with issue 8 first. Stand by for issue 9. Issue 8, protecting children from lead exposure budget change proposal. Mark Starr, Greg Oliva, and we'll hear from Finance, LAO, and public comment. We are ready.
Thank you. So the department's been administering a childhood-lead poisoning prevention for some time. This proposal asks for additional resources within the existing childhood-lead poisoning prevention fund of $8.2 million for 4 years and 7 staff. What we would like to do, and bear with me as I explain this, is the manner in which that we measure elevated blood lead levels in children today is that any child measured with a level of 20 micrograms per deciliter is considered eligible for case management services. So we monitor that child for 2 to 3 years to make sure that the blood level goes down, provide education, links to treatment providers. We just really want to get that blood level down. And then any child with a persistent or 2 measures of 15 micrograms per deciliter, we will provide those same services. And for what we're trying to do with this proposal is to lower the manner in which a lower microgram per deciliter, so that from 2 persistent measures of 10 micrograms per deciliter or 1 measure of 15 micrograms per deciliter would be eligible for case management services. And this is based upon guidance and recommendations from the Centers for Disease Control as they've nationally monitored childhood lead levels for some time. So we believe that we have the funding available in the fund to support those services for 4 years. The reason why we're asking for local assistance of $6.8 million is that the state is required to implement the program, but we can do that through contracts with counties. And not every county chooses to work with the state in implementing this program. So where the counties don't implement the program, the state's responsible for delivering it. So we've asked for $6.8 million in local assistance, but we've also asked for $1.4 in support so that we have the appropriate staff to go out in those communities and provide those additional services to those kids.